My name is Nola Ries. I'm a professor in the Faculty of Law at University of Technology, Sydney, and a co-founder of the Dementia Law Network. My research focuses on the legal needs of people with dementia and their carers, as well as how legal services and policy frameworks can support a more dementia-inclusive society. The area of research I discuss here concerns situations where a person with dementia has behaviors that may be seen as aggressive or inappropriate or even as criminal offending. I collaborate with other researchers on these issues, especially Associate Professor Fiona Comfer, who is a neuropsychologist at Sydney University and a co-founder of the Dementia Law Network. Now, by way of context, many people with dementia do experience changes in behavior, and sometimes those behaviors can pose risks of harm for other people, and these situations can escalate to contact with police. So we've investigated these kinds of issues in several ways. First, among people being assessed for dementia, a questionnaire was used to ask about behaviors that could be perceived as criminal offenses. Interviews were conducted with carers to learn more about those kinds of behaviors and their experiences, the impacts on them and the person with dementia, and recommendations for how to improve experiences. And third, working with Carers New South Wales, we analyzed data from the 2022 National Carer Survey that focused on carers of people with dementia. So the key findings from this research were first that behaviors that can be seen as criminal legal violations are fairly common. So they were reported in around 40% of people being assessed for dementia. Examples included being verbally abusive towards another person, threatening to physically assault someone, or engaging in behaviors or making comments that were seen as socially or sexually disinhibited. In around 20% of these situations, there was contact with police or other authorities like security personnel. And some of the consequences included the person with dementia being detained for questioning, being banned from going to community venues like shops or clubs, in some cases being charged with criminal offenses, being taken to the emergency department, having mental health orders put in place, or domestic violence orders. Carers described for us how there's a lack of awareness that changes in behavior and personality can be a sign of dementia. And governments across Australia say they are committed to achieving a society that is more understanding of dementia, more inclusive of people living with dementia, and more supportive for carers. So the recommendations that we heard from carers relate to those three areas. So first, there is a need for more education to improve community understanding of dementia, especially to be aware that it's not just an older person's disease, and it's not just always or only about memory loss. Training for first responders like police is essential, and earlier in 2024, Dementia Training Australia released a free 1-hour online course on dementia for first responders. Second, in our research, carers described how community support workers were a game changer to help a person with dementia participate in community activities. So access to trained support workers is another key recommendation. And according to the National Carers Survey, carers of someone with dementia can often feel socially isolated and experience high levels of psychological stress. So access to peer support groups and respite services are important to help alleviate these issues for carers. And health, community, and aged care services should make sure they check with carers to ask about their needs and be able to offer help. Thank you for the opportunity to share this research snapshot. I would be happy to hear from anyone with questions or comments, and you can find more information on this area of research on the website of the Dementia Law Network.